Hello, Temple. Thank you for joining the Wellness Resource Center and Student Health Services to discuss stigma and misconceptions surrounding sexually transmitted infections, or STIs. My name is Kate Pavlicek, and I'm the Sexual Health Program Assistant at the WRC. We also have Laura Bennett from Student Health Services with us, here to help us dive into this discussion on STIs. Would you like to introduce yourself?
Hi, I'm Laura. I'm a nurse practitioner at Student Health. I've been here for almost 2 years at the end of March. Before that, I worked at CHOP Primary Care in New Jersey for almost 10 years. But I'm definitely happy to be a part of the student health team and happy to serve students in any way that they need.
Awesome. Let's start by talking a little bit about student health services and how you all serve Temple students. Can you walk us through what students might expect from an STI testing visit at Student Health, or how to make an appointment, and what STIs are tested for at these appointments?
Sure. So student health is pretty much here for any health needs that students would have on campus, whether it is like a sexual health visit, primary care concerns like rashes, colds, immunization requirements, really anything you would think of to talk to your primary care doctor about, things similar to urgent care visits. If you have any health concerns, really you can reach out to Student Health and ask us if we're able to help you with any concerns. So it's anything from like a cold visit to sexual health to primary care. We even have a phlebotomist in the lab here. At our clinic, though, in regards to sexual health, we offer STI testing for students with or without symptoms. So that would mean a symptomatic visit or just routine screening. If somebody doesn't have any symptoms, they can schedule testing with one of our nurses by calling our office, or we also have a portal online for patients to schedule visits with the nurse or provider, be it a nurse practitioner or physician. If someone has symptoms of a sexually transmitted infection, which examples of that would be pain with urination, discharge, a rash in the genital region, we schedule them with a medical provider for a sexual health visit. During the appointment, the student would come to our office, check in with the front desk. We do have everyone complete a yearly sexual health history form, and then the nurse would bring the patient back to a private confidential exam room, collect a urine sample, or sometimes we have the patient do a self swab to test for chlamydia and gonorrhea. We also can do blood tests for HIV, hepatitis, syphilis if concerns, since we have an on-site lab with a phlebotomist that's here Monday to Friday. The nurse will review the student or patient's sexual health history and go over prevention, and then confirms what pharmacy the student would prefer in case we do have any positive test results and treatments needed. And we do have a dispensary or pharmacy in our office in the waiting room for things like birth control, antibiotics, routine medications that we would prescribe for primary care or sexual health visits. So that way it's kind of like a one-stop shop.
Okay, awesome. And how do STI tests work? Thinking about different kinds of tests that people do, and what they look like.
So there are a few different kinds of testing. Urine testing is utilized to screen for gonorrhea, chlamydia, and trichomonas. The patient would simply come in, provide a urine specimen in a specimen cup, which we send to the lab, and those results come back within 4 to 5 days. For diseases such as HIV and syphilis or those kind of infections, we do a blood test. So they go to the lab, have blood drawn, and those results are also back within 4 to 5 days. Things like herpes, we usually do a swab of the area if there's any kind of concern for like a cold sore or a rash, because it's more accurate than the blood test for herpes, and that also comes back within 4 to 5 days. None of the tests are painful at all. They're not really invasive. They're all done confidentially. And a lot of times, if we have a patient do a self swab, they collect it on their own in the bathroom in a private way.
Okay, good to know. We know that many students who come to Temple have different experiences with sex education and access to sexual health care. Can you talk about what STIs are and how they're transmitted?
That's a great question. So, sexually transmitted infections are infections caused by bacteria, viruses, or parasites that are passed from person to person during intimate sexual contact, including vaginal, anal, and oral sex. Common infections would include chlamydia, HPV, and herpes. They're all spread via bodily fluids or skin to skin contact, and a lot of times people have no symptoms.
Good to know. What are how do we prevent STIs from spreading?
So, the most effective way to prevent sexually transmitted infections would be abstinence, but for people who are sexually active, using a latex condom during all genital to genital contact is the one of the best ways to reduce your risk for any kind of STI. Barrier protection during oral sex is also recommended, and having sex with one person who's only having sex with you also helps reduce the risk of getting an STI. And knowing someone's status, like when was their last routine testing, having an honest and open communication, because your safety is number one, and you should expect that from a partner to communicate with you.
For sure. What are the differences between being cured for an STI versus being treated for one?
So that depends on if it's viral or bacterial. So some sexually transmitted infections like chlamydia or gonorrhea are bacterial infections that we can cure with antibiotics. They don't always have symptoms. Um, so STIs that are viral, such as herpes, hepatitis, HIV, we can't cure them, but we can give antiviral medications to manage how often someone has an outbreak, symptoms, or an infection and lower the risk of transmitting that infection to others. Like if someone has a cold sore, for example, which is oral herpes, we can give medication called Valtrex, and that will shorten the duration of like the painful lesion near your lip, how long it's going to be there, how painful it is, and the chance of spreading it to somebody else and suppressing the virus so that it doesn't cause symptoms.
Mm-hmm. Um, can you talk about the differences between these bacterial and viral STIs?
Sure. So examples of bacterial STIs would be chlamydia, gonorrhea, and syphilis. They're all treated with antibiotics. Some are treated with oral antibiotics like doxycycline, would be a good example that treats chlamydia, which is the 7-day course of pills that you would take. Whereas others like gonorrhea and syphilis are treated with a dose of injectable antibiotics that you receive usually about one time. Examples of viral STIs would be herpes, oral or genital, genital warts, HIV, hepatitis B and C, and something called molluscum. It's similar to genital warts. Viral STIs can't be cured, but they can be managed with medications like antiviral drugs.
Good to know. Do STIs lead to long-term health effects?
Yeah, so STIs can lead to serious long-term health effects if they're not treated. For example, chlamydia and gonorrhea, which are pretty common, can cause pelvic inflammatory disease in women or patients that are assigned female at birth because they can lead to infertility, ectopic pregnancy, which is a pregnancy outside of the uterus, and chronic pelvic pain. In men or patients that are assigned male at birth, they can sometimes cause infertility due to scarring of the testicles and damage. Some STIs are also linked to cancer. When you think of that, you would think of like HPV. It can lead to cervical and other cancers, and then hepatitis B and C can cause liver disease and liver cancer. Also important to note, STIs can cause pregnancy complications later in life, including preterm birth, a NICU stay, infection in babies. And also, when you have one STI like chlamydia, it can increase your chances of getting chlamydia again or having other infections like HIV because it just makes your body more susceptible to other infections. But early testing and treatment, especially for bacterial STIs like chlamydia and gonorrhea, can prevent most of the long-term complications.
Interesting. Do people always get these like long-term health effects with STIs, or can treatment help limit that?
Treatment definitely helps limit it. A lot of patients that come in that we just do routine testing on that have no symptoms, it's found very early on. They're treated. It also limits how many people they transmit it to. And like I said, a lot of patients are asymptomatic. So if you go in for routine testing and you're, have a healthy, sexually active life, and it's caught on a routine screening, then it's usually treated early and it doesn't lead to any long-term consequences.
Yeah, that's good to know. It sounds like that routine testing is great to be able to
Mhm.
catch, no matter how sexually active you are or how many different partners you have, to be able to
Yep,
detect early some of those asymptomatic diseases that could be going around and help prevent any future complications.
for sure.
Where can students go for more information on STIs?
So I usually always recommend the Planned Parenthood website. They also have low cost testing, information on different contraceptive methods, various information on different infections. The Mayo Clinic and the Cleveland Clinic are pretty good too when you because they're non-biased. They're just places that do research and have patient education on their websites. They usually are one of the first things that come up if you do a Google search. And it's written pretty easy to understand. And then the last one would be the American College Health Association website. We use that a lot also, just because it goes over everything for college health and the STIs that we see most frequently in college students.
Sounds good. Those seem like some really great resources to be able to get information. And then
Mhm.
obviously students know that they can come to Student Health with any questions as well,
Mhm.
and go to Student Health for that testing. So you can't get into Student Health for some reason, you can go to Planned Parenthood. There's a lot
Yes,
of other resources if you're in Philadelphia in the city that you can go to for a low or no cost testing and treatment.
correct.
So
Yep.
lots of great resources for that. That's awesome. Is there anything else you'd like to cover that we haven't already gone over today?
So I would just like to say a lot of our routine testing appointments that are with the nurse can easily be scheduled online through our website. If a patient or student if you go onto the Temple Student Health website and you log on and you don't see any availability for an appointment, it's either because um, they only open a few days ahead of time. So I think it's 3 to 4 days ahead of time they'll be posted. Um, or the online appointments are gone. So if you don't see something that works for your schedule, just call the office. It's 215-204-7500 and we can always work something out. We always have extra spots. If you think something is urgent, we're really just a phone call away and we can usually have something the same day or the next day. And if it's like a time that doesn't work with your class schedule, one of us can always, message you back in the portal or work something out. We also provide free condoms at Student Health with no appointment needed. They're right in the waiting room. There's a dispenser. And obviously, the WRC also offers free condoms and lubricant during normal business hours. Plan B is available at Student Health for $8 without an appointment through our dispensary. There's just a quick questionnaire you have to do on the computer when you come in the waiting room. And then for asymptomatic patients, we also provide pap smears and annual exams as part of routine sexual health care.
Good to know. One more question I have
Yeah.
for people who might be worried about maybe their parents or their families or anybody else, like no friends, maybe knowing that they went to student health.
Yes.
Are the services offered by student health confidential?
So that's a great question. I feel like we also go over that with every patient when they come in because it's important, right? You want your sexual health to be confidential as any healthcare should be. So yes, the appointments are completely confidential. There's no way that your parent could log into your health portal. It's not accessible to anyone but you. You would have to give written permission for anything. A lot of patients are always concerned also, which is a good point, about billing. So we don't bill for any visits at Student Health, but for example, if you have any kind of testing, be it like blood work, a swab, a urine test that we send out to the lab, that can get billed through your insurance. So if you're on your parents' insurance, sometimes it will come up on their explanation of benefits. A workaround for that would be we are able to do testing without insurance for a sliding scale low cost fee that doesn't go through insurance at all. And so they would never see the testing or know that it was done.
Good to know.
Does that answer the question?
Yeah, that definitely
Yeah.
answers the question. Thank you so much for joining us for this
You're
important discussion.
welcome.
Um, we hope that students leave this discussion with some new knowledge and ideas about sexual health that might change their perceptions on STIs. If
Yeah.
you or a friend needs help, please reach out to us. We're always happy to assist in students' wellness. The WRC office is located on the second floor of the Student Center, right above the food court. And again, you can come to us to get up to 20 free condoms a month. So that can be really helpful. We offer a bunch of other services as well. So definitely stop by our office. And Student Health Services is on the fourth floor of 1700 North Broad Street, which is right near the Wendy's on Broad
Yeah.
Street. And you can follow the WRC on social media at BeWellTU on all platforms. So with that, BeWellTU, thank you for joining, and thank you, Laura, for joining us today.
Thank you. Happy spring.
Be spring.